If you have always wondered when to stop finasteride, what are the side effects of finasteride, and how to stop finasteride, and what are the alternatives for finasteride for your hair loss problem, then this video is specifically meant out for you. I am Dr. Satya Saraswat, an American board certified hair loss hair transplant surgeon and a gold medalist plastic surgeon, and serving the patient of hair loss since 2006, that is around 19 years till now, and have treated many patients of such problem. If you want to know more about such informative topics and want to watch out such useful videos, we request you to subscribe to our YouTube channel. The first question is, how does finasteride work? And we all know that finasteride works by blocking the 5-alpha reductase type 2 enzyme. There are two types of 5-alpha reductases, type 1 and type 2. The type 2 is found in the hair roots and prostate, and the type 1 is found in various other organs like skin. Finasteride blocks the type 2 5-alpha reductase. This prevents the conversion of testosterone to 5-dihydrotestosterone. And as we all know, that the male pattern hair loss, also known as androgenetic alopecia, happens because of the excessive level of 5-DHT or 5-dihydrotestosterone, which attaches itself in the root of the hair and prevents further proliferation or generation of the new hair cells. So once the 5-DHT levels become lower because of finasteride, then this shedding of hairs or the new hair cell formation comes back to its original position, and the hair loss is delayed or prevented as long as you are taking finasteride. It has been seen that finasteride is effective in around 90% of the patients who are taking it at a dose of 1 milligram. But the important thing is that you have to take this under the supervision of a physician. So it has to be taken after taking a proper consultation, and do not go by the advice which is given in the video here. So this is in a very short or a very brief how finasteride actually works. Please like the video if you think that this is useful for you. Now coming to very important aspect, the side effects of finasteride. The primary or the most worrisome of that is the sexual dysfunction like loss of libido, erectile dysfunction. The other side effects of finasteride, mood depression, suicidal ideation, and it has the exact reason for these side effects is not known, but it has been speculated that finasteride does change some neurotransmitters. Those are the chemicals which are present in your brain. So you have to be cautious. The percentage of these side effects varies in different studies, but generally these side effects are seen in around 2 to 3% of the cases, not in everybody. So if 100 people are taking, 2 or 3 can have the side effect, and if you have started taking it, then initially for a few months, 3 to 6 months, you should be conscious and aware, and if you feel these side effects, you should discuss, either reduce the dose or you can stop finasteride altogether after discussing with your hair loss physician. Please mention in the comment section below if you have faced any such side effect of finasteride or any other side effect which you may be thinking may be happening in your case because of finasteride. Now coming to the most important question which we are discussing here, when to stop finasteride. So there are 3 case scenarios where you can stop finasteride if you are taking it. First is that if you are not seeing any effect from finasteride even after taking it for a period of around 6 months or so, you should give a trial of around 6 months to see the actual benefit. Even after 6 months, then probably it is time for you to consider that you may not be a responsive patient. Finasteride is effective in around 90% of the patients who are taking finasteride in preventing further hair loss and regrowing some of the hairs which you have lost. The second scenario would be if you are facing any side effects which we have just discussed in brief, like sexual side effect, mood disorders, or any other side effect. And the third scenario, or where you can stop finasteride, is when you are planning pregnancy. As a couple, if you are planning a pregnancy, then finasteride theoretically can cause some problems in the child. Ideally, it should be stopped around 2 to 3 months before planning your pregnancy, although there is no such study which actually proves that finasteride does cause these side effects in the baby. But still, from the preventive aspect, it is very important for you to know that such side effects theoretically can exist, so you should not take such chances, and then you can stop finasteride. If you are planning hair transplant for yourself, you can call us at the numbers mentioned on the screen here. Now, how to stop finasteride? First thing is, if you are stopping finasteride and you do have a hair loss problem which you need to be addressed, then if you are taking other medicines like minoxidil application as a lotion form or as a tablet form, whatever your doctor has prescribed, please do not stop that also with finasteride. At least one of the medicine should be taken along with the supportive medicines like biotin-based multivitamins or therapies like PRP or GFC, growth factor concentrate, or low-level laser therapy or microneedling, whichever you may be taking. So do not stop everything all together at the same time. If there is definitive side effect of finasteride which you are observing, especially the sexual side effects, then you have to be very proactive about stopping finasteride, and you should stop it as quickly as it has appeared, because very rarely the side effects may be there for a long time also. So if you feel like that, please do consult your doctor and stop finasteride immediately. If you are suspicious that probably it is due to finasteride, or you are not very sure that you have such side effect but have a suspicion that this may be there, then you lower the dose of finasteride from daily to alternate day or twice a week as per the advice of your doctor, and see if that side effect still persists or not. If that side effect has gone and your hair loss is also still stable even after decreasing the dose, then probably that dose will work for you and you can go for a lower dose. But please do consult your doctor. This has to be stopped only after discussing your doctor who has prescribed it to you. If you want to know more in detail about finasteride, please click the video on the link given above. In the last part of this video, we are going to discuss alternatives to finasteride. Suppose it is not effective in your case, these DHT blockers are to be taken. If finasteride is not effective, then in that case you should think about alternatives of finasteride. The primary such alternative is dutasteride. Dutasteride is much more effective than finasteride because it blocks both type 1 and type 2 5-alpha reductases. Also, the side effects of dutasteride are slightly higher than finasteride. Apart from this, there are some naturally occurring DHT blockers which we are going to discuss here. One of them is saw-palmetto, and it is known that saw-palmetto has a weak DHT blocking property. Other few known DHT blockers are nettle root, green tea, and pumpkin seeds. Another naturally occurring DHT blocker is giant dodder. This is discussed in a video given in the link above, 5 naturally occurring DHT blockers. So you can watch this video to know how all these DHT blockers do act and how effective they are. If you find this video useful for you in managing your hair loss problem, or you know somebody who is struggling with this problem about finasteride and wants to know in detail about how and when to stop finasteride, please do share this video with your friends. If you want to know about minoxidil in detail, we request you to click the video on the left, and if you want to know or see the results of one of our hair transplant patients, please click the video on the right.